Before we start, if you are interested in sports science, evidence-based practice, and practical insights for your professional work, make sure to subscribe to the channel and like this video. This helps more professionals access this kind of content. Today, we're going to talk about a very important concept in sports medicine, the misunderstanding of the term risk factor. This presentation is based on a paper by Stovitz, Impellizzeri, and Shrier, and it can directly impact how you interpret research and make decisions in practice. One of the biggest problems in sports medicine research is how the term risk factor is used. Sometimes it is treated as a cause. Other times it is just a statistical association. The issue is that when we confuse these two meanings, we may end up recommending interventions that do not actually change the outcome. In other words, we may be acting on the wrong targets. To understand this, we need to separate two types of associations. A causal association means that changing a variable will actually change the outcome. A non-causal association means that the variables are related, but changing one will not affect the other. This distinction is essential because only causal factors should guide intervention decisions. Many associations in research are not causal. They can be explained by confounding, where a third variable influences both the exposure and the outcome, or by selection bias, where the way we select participants creates a false relationship. If we don't recognize these mechanisms, we may believe we found a cause when we actually found a coincidence. In epidemiology, risk simply means probability. It does not mean danger, and it does not imply causality. But in everyday language, risk is often interpreted as something dangerous that should be avoided. This creates confusion. For example, having had ACL surgery increases the risk of a new injury, but that does not mean the surgery causes the injury. A common mistake is the use of the term modifiable risk factor. Just because a factor can be changed, it does not mean that changing it will change the outcome. This is a critical point. Interventions should preferably target factors with evidence of causal effect. And when causality is uncertain, we must carefully consider the rationale, costs, risks, and possible harms before acting. Our brain is naturally wired to see cause and effect, even when it doesn't exist. We tend to believe that if something happens after another, then the first caused the second. This is known as the post hoc fallacy. Because of this, even neutral terms like association are often interpreted as causal. This leads to a practical problem. When non-causal associations are interpreted as causes, professionals focus their time and resources on the wrong factors. Research may use causal language without proper evidence, and interventions may be implemented without real effect on the outcome. So, what should we do? If the evidence supports causality, we should use the term causal risk factor. This means that changing the factor is expected to change the outcome. These are the factors that should guide intervention strategies. When a factor is associated with an outcome, but is not its cause, we should call it a non-causal risk factor. These factors are useful to identify high-risk groups. They are useful for monitoring and prediction, but they should not be used as direct targets for intervention. And when we are not sure about causality, we can use the term risk marker. This is a more neutral term. It avoids making assumptions, and it is especially useful in early stage research or prediction models. To summarize, not all risk factors are causes, and confusing association with causation can lead to ineffective decisions in sports practice. Using precise language helps us make better choices, design better interventions, and improve athlete care. If you found this content useful, don't forget to like the video, subscribe to the channel, and share it with colleagues who work with sports science or health. Thanks for watching, and see you in the next video.